Welcome back to in this session. In this session, we'll be discussing about the muscles and movements around the trunk and the spinal column. All of us know it is the vertebral column, and there the spinal column is the axis of body and protector of the neuraxis. It is the vertebral. These are the structures which protect the entire spinal cord, and it is a link between upper extremities and lower extremities. And another function of the vertebral column is it is transfer load from head and trunk to the pelvic region and to the lower limbs. And like any other joints, these joints, vertebral joints, are having both stability and mobility functions. It is in some part it is more mobile, and some part it is less mobile, but in other areas it is more stable and less mobile. So here also this spinal vertebral column, entire vertebral column and its joints are stable also and mobile also. Now, entire vertebral column is formed by 33 vertebrae, and in between vertebrae we can see intervertebral disc, and there are 23 intervertebral discs. The vertebral column can be divided into 5 different parts. That is cervical region, thoracic region, lumbar region, sacral region, and coccygeal region. Cervical region consists of 7 cervical vertebrae. At the same time, thoracic region consists of 12 thoracic vertebrae, and lumbar region consists of 5 lumbar vertebrae, and sacral region consists of 5 vertebrae, sacral vertebrae again, and these 5 sacral vertebrae are fused together, and coccygeal region again consists of 4 coccygeal vertebrae. So the total number of vertebrae is 33, and in between these vertebrae there are intervertebral discs, and around 23 intervertebral discs are available in between the vertebrae. Now, once you see the vertebra from the front or back, you can see it is exactly straight, or it is very much straight. It is straight while viewing from front or back. But once you see the entire vertebral column from the side, that is sagittal view, you can see lots of curvatures in the vertebral column. You can see in the cervical region, there is a concave, posteriorly concave, there is curvature, and the thoracic region there is a convex posterior curvature. In the lumbar region again you can see a concave posterior curvature. In the sacral region you can see a convex posterior curvature. So the main advantage of these curvatures are because of these curvatures it can resist high compressive loads. So there are lots of curvature. Once you see from the sagittal side or from the sides, you can see lots of curvatures. That is, in the cervical region there is a concave curvature posteriorly. In the thoracic region there is a convex posterior curvature. In the lumbar region there is a concave curvature again. In the sacral region there is a convex curvature again. If the curvature is convex posteriorly, it is known as a kyphotic curve. And if it is the anterior convexity is there, that type of curvature is known as a lordotic curve. Now we have a cervical lordosis or cervical lordotic curvature is there. Then there is a thoracic kyphotic curvature and lumbar lordotic curvature is there. Now, at the time of birth, all the curvatures we can see a posterior convexity or a posterior convexity of the curvatures can be seen at the time of birth, and these posterior convexity curvatures are they are known as primary curvatures. So thoracic and sagittal curvatures are known as primary curvatures, and at the same time the lumbar and cervical curvatures, these become the lordotic curvatures in the later life, and so it is known as secondary curvatures. So there are primary curvatures and secondary curvatures, and primary curvatures are the thoracic and sacral curvatures, and at the same time lumbar and cervical curvatures are the secondary curvatures. Now we will go through the regarding a typical vertebra, an anatomy of a typical vertebra. A typical vertebra can be divided into two parts. An anterior vertebral body is there and a neural arch which contain lots of small elements. So anterior part is the vertebral body and it is the weight bearing structure of a vertebra. And it is a dense, there is a dense bony cortex and it is surrounded by a spongy medulla is there, and the periphery of the vertebral body is thickened and form a distinct rim. And inside there are lots of, inside the vertebral body there are lots of trabecular system, and there is a triangular area of minimum resistance where the trabecular system is not fully developed, and at the center we can say it is a triangular area of minimum resistance. So there higher loads we cannot put higher loads. An axial compression of a 600 kilos can cause fracture at the central region, but because of the heavy rim and heavy dense cortex rim, it can withstand, the entire vertebra can withstand up to 800 kilogram of load. Now the posterior part is the neural arch. Neural arch again can be divided into two. The first one is pedicle and the second part is the posterior element. The pedicle is the connection between the posterior element and the vertebral bodies, and its main function is transmission of tension, transmission of weight through vertebral bodies to the posterior elements. And posterior elements, it consists of lots of small elements. It includes lamina, articular processes, spinous processes and transverse processes. Now, we discussed about the typical vertebrae, and in between the vertebrae we can see the intervertebral disc, and it forms around 20 to 33% of the length of the vertebral column. We can also notice that there is an increase in the size from cervical region to the lumbar region, and so we can get a smallest intervertebral disc in the cervical region and the largest intervertebral disc in the lumbar region. And the ratio between the thickness of the intervertebral disc and the thickness of the vertebral body, that is vertebral height, determines how much available range of motion is there in the vertebra. Now in the cervical region and lumbar region, the ratio is more, so more movement is available in the cervical and lumbar region, and at the same time in the thoracic region the ratio is very less, and there is very less movements are available in the thoracic region when compared to cervical and lumbar region. So greater ratio means greater mobility, and greatest ratio is in the cervical and followed by lumbar region, and smallest ratio seen in the thoracic region. Now, what are the functions of the intervertebral disc? The one main function is it increases the available range of motion. It separates the vertebral bodies and increases the range of motion. The second one is that transmission of load. The transmission of load from one vertebra to the other vertebra, and it acts as a pad and maintain the space between the 24 vertebral bodies, and the another most important function is it acts as a shock absorber. These are the functions of the intervertebral disc. Now, the parts of an intervertebral disc can be divided into two parts: a central nucleus pulposus and an outer annulus fibrosus. Nucleus pulposus is a gelatinous mass seen in the center, you can see in the picture, and annulus fibrosus is a fibrous ring, fibrous outer ring, and there is a part called vertebral end plate, and most of the books are saying it can be considered as a part of intervertebral disc, and some researchers are saying that it cannot be considered as a part of IV disc. Anyway, these are the vertebral end plates, and these are the cartilaginous layer covering the superior and inferior surface of the intervertebral disc. Now we will go through the different joints or different articulations in the vertebral region. There are mainly two types of articulations seen in the vertebral region. These are interbody joints and facet joints. Interbody joints we studied the body of the vertebra, and the junction between the two vertebral bodies are called intervertebral joints. These are the cartilaginous symphysis joints between the vertebral bodies, and the movements available in between these bodies are gliding, distraction, compression, and rotation. So these are the movements available between the intervertebral bodies. Now the facet joints. Facet joints in another joint seen in the vertebral column, that is it is formed between the articulation between right and left superior articular facet of a vertebra and inferior facet of the adjacent vertebra. So inferior facet of a superior vertebra and superior facet of an inferior vertebra makes the facet joint. And again, it's a synovial type of joint, diarthrodial joint, and there are intra-articular, like any other synovial joint. It also contains, there are intra-articular accessory structures like adipose tissue or fibro-adipose meniscoids are present inside this joint. And the main function is the protection of the articular surface during different movements of the vertebral column. Now, regarding the ligaments, there are lots of ligaments seen in the vertebral column. The main function is of this ligament is the stability of the vertebral column. Along with that, it acts as a restraint to some motions, and another function is the main important function is the stability of the vertebral column. And mainly we can see the 6 important ligaments are seen in the entire vertebral column, and it is usually seen from the cervical region to lower cervical region to the sacral region, and in the upper cervical region these ligaments are known in another name. And these ligaments are, the first one is anterior longitudinal ligament or ALL, posterior longitudinal ligament or PLL, ligamentum flavum, interspinous ligament, supraspinous ligament, and intertransverse ligament. Now the first one is the anterior longitudinal ligament or ALL. These are, by the name itself we can understand that it is seen anterior to the vertebral bodies. That is, runs along the anterior and lateral surface of the vertebral bodies. You can see in the picture. That is, runs along the anterior and lateral surface of the vertebral bodies from sacral region to the C2 vertebral level, that is second cervical vertebral level, and its extension from the second cervical level to the occiput. It is known as in another name, that is anterior atlanto-occipital ligament and atlanto-axial ligaments. These are the extension of the anterior longitudinal ligament in the, that is from the C2 to occiput. So anterior longitudinal ligament, it runs in the anterior and lateral surface of the vertebral bodies from the sacral region to the C2 level. Now the second important ligament is the PLL or posterior longitudinal ligament. So it is seen in the posterior aspect of the entire vertebral column. Again, like ALL, it is seen from the sacral level to the C2 level, and C2 to occiput, it is known as pectoral membrane. And as it is on a posterior structure, once the spine goes into extension, the ligament get relaxed or slack. Next important ligament is the ligamentum flavum. Ligamentum flavum is one of the strongest ligament in the lower thoracic region, and it is from C2 to sacrum, and it is highly elastic in nature, and it forms a smooth posterior surface of the vertebral canal. That is, inside the vertebral canal, it forms the smooth posterior surface, and it is the strongest in lower thoracic region. And once, as it is a posterior structure, once the vertebra goes into flexion, the ligament gets stretched, and under constant tension, even the spine is in the neutral position, as it's having an elastic nature, highly elastic in nature. So this ligament will be under constant tension at any point. And next ligament is the interspinous ligament. By the name itself, we can understand that this ligament is between the spinous processes. Now, it is connect the spinous processes of adjacent vertebrae, and interspinous along with the supraspinous ligament is the first to be damaged with an excessive flexion. So, this is the interspinous ligament. This is the ligament which connects between the spinous process, and this is the first ligament when injured once there is any flexion movement or flexion injury is there. Next one is the supraspinous ligament. Again, it starts from it is from the tip of the spinous process of the seventh cervical vertebra to the L3 or L4 level, that is lumbar, third lumbar or fourth lumbar level. And the cervical region, again it is known as ligamentum nuchae, and it is another ligament which is one ligament which fails in flexion. And this ligament contains lots of mechanoreceptors. So, whenever there is any changes in the body position, any changes in the vertebral column position, these mechanoreceptors get activated, and there is recruitment of the spinal stabilizers also. Next is the intertransverse ligament. Intertransverse ligament is the ligament between the transverse processes, and it is attached to the muscles of the back, and in the lumbar region it resembles a membrane, and it is stretched and compressed during lateral bending, because as it is on the lateral side, as it is between the transverse processes, it is stretched and compressed during the lateral bending. Now, we will go through the different movements available in the spinal column as a whole. The movements available in the spinal column as one spinal column and trunk. The first one is the flexion movement, then extension, lateral flexion, rotation, and a coupled motion, that is along with the usually a coupled motion also can occur, that is flexion along with the rotation, it is a coupled motion. Now, the range of motion of each movement. The first one is flexion. In the lumbar region it comes around 60 degree, and in the cervical region it is 40 degree. At the same time, extension lumbar region is 35 degree, the cervical region it is 75 degree. Lateral flexion in the lumbar region 20 degree, thoracic region 20 degree, and in the cervical region it comes 35 to 45 degree. And axial rotation, lumbar region 5 degree, thoracic region 35 degree, cervical region 45 to 50 degree. So, first now we will be starting with the cervical region. We will go through the different structures in the cervical region. The cervical region is made up of two functionally distinct segments. The first one is a superior segment. We can divide into a superior segment and an inferior segment. Superior segment, it is also called a suboccipital segment or a craniovertebral region. It consists of the first vertebra and the second vertebra and occipital condyles. Occipital condyle, then first vertebra, that is atlas, and the second vertebra axis, and from C3 to C7, that is third cervical vertebra, to the seventh cervical vertebra, it is considered as the inferior segment. And atlas and axis and the C7th vertebra, these are atypical vertebrae, that is, it does not have a proper characteristic, but at the same time C3 to C6, this having similar characteristics. So, these vertebrae are known as typical vertebra, that is cervical vertebra 3 to cervical vertebra 6. These vertebrae having similar characteristic. Because of the similar characteristic, these are known as typical cervical vertebrae. But at the same time, axis, atlas, and C7th vertebra does not have some similar characteristic. So, these are known as atypical vertebrae. And all the cervical vertebrae is having a special feature from the other vertebrae is that it is having a transverse foramen for the passage of an important artery, that is vertebral artery. Now, we will go through the structure of a first vertebra, that is atlas. Atlas, it is a ring shaped vertebra, you can see in the picture. Atlas, the C1 vertebra, it is a ring shaped vertebra with its transverse diameter is more than the anteroposterior diameter, and it is having two lateral masses which is oval in shape, and there is inferior articular surface for the facet of the atlas, and a posterior surface of the we can see there is a posterior surface of the anterior arch. There is we can see a facet for the odontoid process also, and we can see two foramens on the two sides of the atlas vertebra. These are in the transverse surface have a foramen for the vertebral artery. The second vertebra is the axis vertebra. The main feature of the axis vertebra is the presence of a odontoid process or dens. So, consists of a central odontoid process or dens, which acts as a pivot for the atlantoaxial joint. And dens has an anterior facet of articulation with anterior arch of atlas, and spinous process, you can see the spinous process, it is large, elongated and bifurcated or bifid. So, these are the structure, this is the structure of an axis vertebra. Now, we will go through some joints in the cervical region. The first joint is the atlanto-occipital joint. Atlanto-occipital joint means it is the joint between atlas vertebra, the first vertebra, and the occipital region or the lower side of the head skull. Two concave superior facets of the atlas articulate with the two convex occipital condyles of the skull. This forms the atlanto-occipital joint. Now, it is again a synovial joint, again like any other synovial joint, it also having fibroadipose meniscoids or some structures will be there, some fibrocartilaginous structures are there inside this joint. And it is having 3 degrees of freedom. What is degree of freedom? Everybody will be knowing, that is degree of freedom, how many planes it can be moved. So, it is having atlanto-occipital joint is having 3 degrees of freedom. So, the first one is it can move, that you can go for an axial rotation, then next movement available is the flexion and extension, and the third type of movement is the lateral flexion. Now, the second type of joint, second joint seen is the joint between atlas and axis vertebra, that is between the C1 and C2, and again it contains 3 synovial joints, that is 2 on one side and 1 at the center. That is a central atlanto-odontoid joint, that is between the first, that atlas vertebra, and the odontoid process of the second vertebra forms a central atlanto-odontoid joint, with odontoid process serve as a pivot point. And there are 2 lateral atlantoaxial joints with superior facet of the axis and inferior facet of the atlas forms the 2 lateral atlantoaxial joints. So, atlantoaxial joint consists of 3 joints, 3 synovial joints, 2 lateral atlantoaxial joints, and one central atlanto-odontoid joint. Now, we will go through the different movements available in the atlanto-occipital region. The movement is known as the available movement is the flexion and extension, and it is once we do the nodding movement of the neck, the nodding movement of the head, we will get this movement. That is, movement available is the nodding movement, that is flexion and extension is the only physiological movement available, and the range of motion available for the nodding is 10 to 30 degree. Now, atlantoaxial joint, the motion available is the rotation, lateral flexion and extension. It is 55 to 58 degree total rotation. The cervical region is at the atlantoaxial joint. So, we will go through again the movements available at the atlanto-occipital joint, that is between the occiput and the atlas, that is the first vertebra. The movement available is flexion and extension. It is known as nodding movement of the head. And in the atlantoaxial joint, there are 3 types of motions are available, that is rotation, lateral flexion and flexion extension type of movements. And total 50 to 58% of the total flexion rotation of the cervical spine is at the atlantoaxial joint itself. Now, the second section of the cervical region is the lower cervical spine. The movements available in the lower cervical region is flexion, extension, lateral rotation, and lateral flexion and rotation. So, lower cervical region is the region from C3 to C7, that is third cervical vertebra to the seventh cervical vertebra. The movements available is, the first one is flexion and the extension movement. Flexion and extension type of movement. This is the flexion type of movement. You can see in the picture, this is the flexion type of movement. The second one is extension type of movement. It is in the lower cervical vertebra. That is, next is a lateral flexion type of, this is a lateral flexion type of movement. This is lateral flexion. And the next type of movement is the rotation type of movement. This is the rotation type of movement. So you can see in the picture also, that is, this is the flexion type of movement and extension. You can see a rotation type of movement in the second picture and the lateral flexion in the third picture. Now, the range of flexion and extension increases from C3 to C2 to C3 level up to C5, C6 level. The range of flexion and extension increases. But just after that, C6 to C7 level, again the range of flexion and extension decreases. And C5 and C6 level, it's having greatest amount of stress due to a greater range of flexion and extension. So a greater range of flexion and extension is available at the level of C6, C5 and C6. So as the movement is more, there will be more stress in that region. Now we will go through next region of vertebral column is the thoracic region. Again, thoracic region consists of 12 thoracic vertebra and joints between 12 thoracic vertebra. And there are, in any other joint, there is any other part of the vertebral column. It also contains an inter-body joints, that is between the vertebral bodies and between the facet, that is between these facets, upper and lower facet, there is facet joints. And like any other joints, any other vertebral body part, there are lots of ligaments like ALL, ligamentum flavum, TLL, etc. And ALL and ligamentum flavum is thicker in the thoracic region. Now we will go through the structure of a typical thoracic vertebra. Typical thoracic vertebra, unlike the cervical region, a typical thoracic vertebra is having an equal anterior, anteroposterior and transverse diameter. And it's having a wedge shape, that is, the posterior height is more than the anterior height. So as the posterior height is more, and that is the reason of the kyphotic, the typical kyphotic posture or kyphotic curvature in this thoracic region. And transverse process, there is from the transverse process, you can see there is costotubercular facet is there for this is the facet for the ribs. And there is another important thing, another typical thing in the spinous process is that the spinous process, you can see a long spinous process that also sloped inferiorly, and from the T5 level this type of sloping can be seen more obvious from the T5 level. And from the T5 level, one spinous process overlap the other spinous process of the vertebra. So that is from T5 level, overlap of the spinous process of the adjacent vertebra we can see. Now the movements available are, the range of motion of the flexion and extension is limited in the upper thoracic region. The main cause is presence of a rib cage and orientation of the facet joint, in frontal plane orientation of the facet joint. And in the lower thoracic region, facet is in the sagittal plane. So in the lower thoracic region, the movement flexion and extension is more available in the lower thoracic region. So upper thoracic region, because of the presence of the facet, because of the presence of an orientation of the facet joint, and because of the presence of the rib cage, in the upper thoracic region, the movement of flexion and extension is limited. But at the same time, in the lower thoracic region, when compared to the upper region, more movements or more flexion and extension movement is available. And usually in the thoracic region, lateral flexion is always associated with rotation movement. The upper thoracic region, the lateral flexion and rotation coupled in the same direction. At the same time, in the lower thoracic region, the rotation of the lower region is accompanied by lateral flexion in the opposite region. Now we will go through the next region. Is the next important region of the vertebral column is the lumbar region. Again, in the lumbar region, again the vertebra is having a body and the posterior elements, the posterior part, and the neural, that is the body, the shape of the body, you can see it is a kidney shaped. The kidney shaped body and transverse diameter is greater than the anterior diameter, anteroposterior diameter and height, and the pedicle you can see short and thick and project posteriorly. Now, just after the lumbar region, there is lumbosacral articulation is there. That is, it is the articulation between the lumbar and sacral region, and it is formed by the fifth lumbar vertebra and first sacral segments, and it forms an angle with the lumbar region and sacral region. It forms an angle, and this angle is known as lumbosacral angle, and it increase in lumbosacral angle means there is an increase in lordosis. Now, the movements available, will go through the different movements available in the lumbar region. Like cervical region, almost similar movements are available in the lumbar region also. The movements available you can see in this picture. You can see in the picture, the first movement is flexion and extension. That is, the second is you can see the lateral flexion. The flexion is there, extension is there, then lateral flexion is there, and the rotation movements are also available in the lumbar region. So, the movements available are the flexion, extension and lateral flexion and rotation. The first two pictures are the extension and flexion. The picture number 2 is the rotation movement, and picture number 3 is the lateral flexion movement. But the amount of flexion and these movements varies at different levels, and amount of flexion and extension varies at each interspaces. Next region is the sacral region, and we already discussed 5 sacral vertebra forms together and form a single vertebra, and there is a sacroiliac articulation. It articulate with the iliac bone or hip bone. So, there is a sacroilio articulation also can be seen in the sacral region. Now, the movements available in the sacral region is known as nutation and counter nutation. Nutation means in this anterior tip of the sacrum moves anteriorly and inferiorly. At the same time, the coccyx moves posteriorly in related to the ilium. That is, the anterior tip of the sacrum, consider this is the sacral and coccygeal region. The anterior tip of the sacrum moves anteriorly and inferiorly. At the same time, the posterior, while the coccyx that is inferior part moves posteriorly. This is known as nutation. And counter nutation is the opposite movement. This anterior tip of the sacrum moves posteriorly and superiorly, while the coccyx moves anteriorly. So, the motion available in the sacral and coccygeal region is the nutation and counter nutation. Nutation means the anterior tip of the sacrum moves anteriorly and inferiorly, while the coccyx moves posteriorly in relation to the ilium. Now, counter nutation means the tip of the sacrum moves posteriorly and superiorly, while coccyx moves anteriorly. During nutation, anteroposterior diameter of the pelvic beam, the upper side is decreased, and the anteroposterior diameter of the pelvic outlet is increased. Now, muscles, these are the muscles are the main causes of, these are the internal force which causes the intrinsic forces which causes the movement. So, the muscles, there are a group of muscles seen in which causes different movements in the entire cervical and the lower region also, in the entire vertebral column. So, we can divide the muscle groups into two, an upper muscles and a lower muscles, and some muscles are seen both in the upper and lower side. So, we will just go through the upper muscle, that is in the craniocervical and upper thoracic region, which are the muscles available. Mainly the function of the muscles at this in the cervical and upper thoracic region is the first important function to hold the head against the gravity. The second function is the position the head in the space for the positioning of the optimal position of the different sensory organs. So, first important function is the holding of the head in a straight position against the gravity, in a proper position against the gravity. And the second function is the positioning of the head in a space, so that for the optimal position of the sensory organs. Now, another important function is the movements of the vertebral body parts or vertebral column, and along with that, the movement of the scapula is the another function of these muscles. Now, the muscles of the posterior region are: the first muscle, the outer muscle, is the trapezius muscle itself. It is a very large muscle, and then comes the levator scapula. We will discuss it in next slides. So, the first muscle is the trapezius muscle, and the second one is the levator scapula muscle. Then comes just after levator scapula, the splenius groups comes. Splenius group consists of two muscles. That is, the first one is splenius capitis and second one is the splenius cervicis. So, these splenius muscles are seen deep to the levator scapula, and once it works bilaterally, it produces extension of the cervical region, and once it is working unilaterally, it causes an ipsilateral rotation movement. So, just after the splenius group, next group of posterior muscle groups comes. This is the semispinalis group. It consists of again two muscles, semispinalis capitis and semispinalis cervicis. So, it is seen deep to the splenius group, and it produces extension again, as these are the posterior muscles. This produces extension of the head and neck. Then just after the semispinalis groups, there is longissimus group is there. It again consists of two muscles, longissimus capitis and longissimus cervicis, and this is also seen deep to the semispinalis group. Then the deepest muscle groups comes on the posterior region. These are the suboccipital muscle. This is the deepest muscle group in the cervical region. So, this consists of 6 muscles. These are rectus capitis. This consists of 4 muscles, that is rectus capitis posterior major, rectus capitis posterior minor, superior oblique and inferior oblique are the 4 muscles, 4 suboccipital muscles. So, the main function of these 4 suboccipital muscle is that it produces an independent movement of the upper cervical, that is craniovertebral movement region over the lower cervical spine. So, suboccipital muscle, these are the deepest muscle in the cervical region. It consists of the rectus capitis posterior major, rectus capitis posterior minor, superior oblique and inferior oblique, and this main function of these muscles are independent movement of the upper region, that is craniovertebral region over the lower cervical spine. These are the muscles we studied, the different groups of muscles. We studied the muscles seen on the back, that is on the posterior region. Now, the lateral muscles, the muscles seen on the lateral side of the cervical region, these are the scalenes. These are known as scalene. There are 3 scalene muscles are seen on the lateral region. These are anterior scalene, middle scalene and posterior scalenes. The anterior scalenes are, as it is seen on the bit anteriorly and laterally. So, the main function is the flexion of the cervical spine. And the second muscle is the middle scalene, that is, it is exactly in the middle. So, it is a good stabilizer, it is a good frontal plane stabilizer of the cervical region. And posterior scalene, and the main function of the posterior scalene is the lateral flexion of the cervical region. So, the lateral muscles are commonly, that group of muscles are called scalenes. Scalene, there are 3 scalenes are there, an anterior scalene and a middle scalene and a posterior scalene. Anterior scalene helps in flexion, middle scalene stabilization, and posterior scalene lateral flexion is the main function of the posterior scalenes. Now, the anterior muscles. Anterior muscle, main function of the anterior muscle is the flexion, and it helps in rotation movement of also. The anterior muscles are longissimus capitis, longissimus collae, rectus capitis anterior and rectus capitis lateralis are the anterior muscles, and main function of these muscles are the flexion movement of the neck. Now, we will go through the muscles seen in the lower thoracic and lumbopelvic region in the lower side of the vertebral column. Again, the one of the, it is arranged, again these muscles are arranged, especially these are called back muscles, and these muscles are arranged again into three different groups or three different sets. That is, the three groups are, there is a superficial extrinsic muscles, and second one comes the intermediate group. These are also extrinsic muscle, and the next muscle is the intrinsic group of muscles. These are the deep muscles. Now, superficial extrinsic muscles include, these are the muscles which is seen superficially. It connects the limb to the axial skeleton and limb, that is upper limb and lower limb, and it connects the upper limb and lower limb to the axial, the vertebra or axial skeleton, and it is usually innervated by the ventral rami or cranial nerve 11. So, superficial extrinsic muscles are the superficial muscles seen on the back, on the lower thoracic and upper and the lumbar and sacral region. And these muscles, the main function of these muscles are connection of the limb, the upper limb and lower limb to the axial skeleton, and it is innervated by ventral rami or cranial nerve 11. Now, the muscles, these muscles are arranged in fours, and it includes trapezius, latissimus dorsi, levator scapula, rhomboides major and rhomboides minor. So, these are the muscles, superficial extrinsic muscle, superficial muscles seen in the lower vertebral region. So, these are trapezius, latissimus dorsi, levator scapula, rhomboides major and rhomboides minor. Trapezius, intermediate extrinsic muscle consists of a serratus posterior group. It includes serratus posterior superior and serratus posterior inferior. So, intermediate extrinsic muscle consists of again two muscles. These are the serratus posterior group. This includes serratus posterior superior and serratus posterior inferior. Now, there is intrinsic muscles. Intrinsic muscles, these are the small muscles, intrinsic muscles of the back, and these muscles include the splenius capitis and splenius cervicis. We studied it once we have gone through the cervical region, then iliocostalis, longissimus, spinalis, semispinalis and multifidus. These are the muscle, intrinsic back muscle, intrinsic muscle seen in the back region. Now, we will go through the different muscles individually. The first muscle is the trapezius muscle. It is one of the largest muscle in the body, and it is seen in the upper and lower region also, and its origin starts from the occipital region itself. Its origin is the medial 1/3 of the superior nuchal line. You can see in the picture the medial 1/3 of the superior nuchal line, ligamentum nuchae, external occipital protuberance, and spinous process from the C7 to T12 vertebra. This is the origin, that is from the upper region, originate from the upper region itself, that is the medial 1/3 of the superior nuchal line and ligamentum nuchae, external occipital protuberance of the skull, and the spinous process of the C7 to T12 vertebrae. Now, its insertion is at the lateral 1/3 of the clavicle and acromion and spine of the scapula. These are it's having three insertions. The first one is the lateral 1/3 of the clavicle, acromion process, and the third insertion is the spine of the scapula. Now, the action is it is one of the muscle which work on the scapula. That is, elevation and depression of the scapula is the one important function. And the second one is rotation of the scapula superiorly and rotation of the scapula and retraction of the scapula are the main function of the trapezius muscle. So, elevation and depression, rotation and retraction of the scapula is the main function of the trapezius muscle, and this is the muscle which work on the one of the main muscle which work on the scapula. Now, the second muscle in the lower region is in the back region is the latissimus dorsi. Latissimus dorsi, again its origin you can see in the picture. It is from T7 to sacral region, that is spinous process T7 to the sacral region. Then posterior third of the iliac crest, you can see in the iliac crest, that is the hip bone, you can see the posterior posterior one third of the iliac crest. And it also attached, its insertion is from the lower 3 or 4 ribs, and inferior angle of the scapula, inferior side of the scapula is attached to the lower side or inferior side of the scapula. So its insertion is from the T7 to sacral region of the spine, that is the spinous process vertebral spine from T7 to sacral region, posterior one third of the iliac crest, lower 3 or 4 ribs, and inferior angle of the scapula. These are the origins. Now its insertion, it goes upward and inserted, you can see in that picture, that floor of the intertubercular groove. There is a groove seen in the upper side of the humerus. This is the intertubercular between the two tubercles, and the intertubercular of the groove of the humerus, it is attached or it is inserted. Now its main function, as it is attached to the humerus, its main, as it is a back muscles, its main function is at the humerus and arm, and it is a connector, it is one of the connector between the vertebra and the limbs. That is, its main function is extend the arm and rotate the arm. Medial rotation and extension of the arm is the one of the main function. That is, medial rotation and extension of the arm is the main function of this muscle. Next comes the muscle called levator scapula muscle. By the name itself, the function of this muscle is again this is the elevation of the scapula. This is the one of the another muscle which work on the scapula, and its origin is from the transverse process of the C1 to C4 vertebra, and insertion on the medial border of the scapula from the superior angle to the spine, and its function is the elevation of the scapula. Next muscle is the rhomboidus major muscle. Next comes the rhomboidus major. Its origin you can see in the picture. Rhomboidus major, its origin from the vertebra T12, second thoracic vertebra, to T5 vertebra, fifth thoracic vertebra, and its spinous processes. And insertion on the medial border of the, you can see in that picture again, the medial border of the scapula, inferior to the spine of the scapula, is insertion. So from vertebra spinous process of the vertebra T12 to T5 to the scapula, medial border of the scapula, inferior to the spine of the scapula, it is attached. Again, as it is attached to the scapula, its main function is the retraction, elevation, and rotation of the scapula, and depression in the and depresses the glenoid fossa. Next muscle is the rhomboidus minor muscle. And again, it is in inferior end of its origin is from the inferior end of the ligamentum nuchae, spines of the C7, seventh cervical vertebra, to T1, and is again attached to the scapula. That is the medial border of the scapula at the root of the spine of the scapula. Its main function is retraction, elevation, and rotation of the scapula, and depression in the which depresses the glenoid fossa. Then serratus posterior, next group of muscle is the intermediate group of muscles. It consists of serratus posterior superior and serratus posterior inferior. So serratus posterior superior, again its origin from the ligamentum nuchae, spinous process of the C7 to T1 and T12, T3 vertebrae, and it is inserted into the ribs at the lateral angles of the ribs. And its action is elevation of the upper limb, elevation of the upper ribs. So again, the serratus posterior superior and serratus posterior inferior, these are the intermediate group of muscles, and its origin from the ligamentum nuchae, spines of the vertebra C7 and T1 to T3, and insertion is at the ribs. So its function is elevation of the upper ribs. Now comes the serratus posterior inferior. Again, its origin from the thoracolumbar fascia, spines of the vertebrae T11 to T12 and L1 to L2, and its insertion again on the ribs 9 to 12, lateral to the angles of the ribs, and again its main function is the pulling down of the lower ribs. Now comes the group of the muscle which is deep, and these are the actual extensors of the back. These muscles are the extensors of the back. Main function is the extension and stabilizers of the back. And one of the main muscle is the erector spinae, and this is the extensor. It is the one of the major extensor of the trunk, and it consists of two types of muscle groups. Erector spinae consists of a group of muscle, two types of muscle groups, that is longissimus thoracis muscle group and iliocostalis muscle group. So we can divide into two groups. Again, it can be divided into a superficial group and a deep layer also. Now, extensor erector spinae can be classified into two, and longissimus thoracis, it is bit upper side, and iliocostalis, and it is as in the bit lower side. Longissimus, again this can be again classified into a superficial layer and a deep layer. Superficial layer consists of longissimus thoracis, pars thoracis, and iliocostalis, pars thoracis. These are the superficial group. And deep muscles, the names of the deep muscles are iliocostalis, pars lumborium, and longissimus thoracis, pars lumborum. So these are the deep muscles. Another important muscle in the lumbar, deep muscle, intrinsic muscle in the lumbar region is the multifidus muscle, and these are again the stabilizer and extensor of the lumbar region, and it consists of a number of fleshy tendinous vesicles which fill up the groove on the either side of the spinous process of the vertebra from the sacrum to the axis. These are a group of muscles, a number of fleshy muscles seen from the sacrum to the axis. Now we can see some lateral muscles, mainly does the lateral movement, lateral flexion movements and hip hiking movements, and the names of the muscle are quadratus lumborum. There are four group of muscles are called quadratus lumborum, and these are the lateral muscle you can see in the picture. And the anterior muscles seen in the vertebral column, these are especially the abdominal muscles. And abdominal muscles consist of especially an abdominal wall consists of four pairs of flat sheet of muscles. There are four pairs of flat sheet of total 8 muscles are there, and these muscles are the muscles which causes the flexion of the especially in the lumbar region, and these are the muscles. The name of the muscles are rectus abdominis, transverse abdominis, external oblique, and internal oblique. So anterior abdominal wall consists of 4 pairs, that is 8 muscles, and which is separated by, and the first one is which is separated by a structure called the linea alba, and the muscles are the rectus abdominis, transverse abdominis, external oblique, and internal oblique. So rectus abdominis, commonly this is the muscle which is known as in peoples which is known as six pack or something, six pack. And these are the two parallel muscles separated by a midline band of connective tissue called linea alba. The linea alba separate the two muscles, two rectus abdominis muscles, and its origin is from the pubis, and it is inserted to the xiphoid process and costal cartilage of that is 5th and 7th costal cartilage. So the rectus abdominal muscles, these are the two parallel muscles, and it is seen between, and it is separated by a tissue called the connective tissue called the linea alba, and its origin is from the pubis and insertion in the xiphoid process and costal cartilage of C7 to the costal cartilage of cartilage 5 to 7. So the next type of muscles, that is the first muscle is which is seen in the central region is the rectus abdominis, and the transverse abdominis and external oblique and internal oblique. These are muscles seen on the lateral side of the abdominal region, transverse abdominis, external oblique, and internal oblique. There are two groups of muscles on the both lateral side of the abdominal wall. So, abdominal wall consists of 4 pairs of muscles, which is separated by the first one is the rectus abdominis. Rectus abdominis are the anterior muscles, which is separated by the linea alba, and there are 3 other lateral muscles, 2 groups of lateral muscles. These are the transverse abdominis, external oblique, and internal oblique. So, these are the muscles seen in the abdominal wall, and there are some references. These are the references, and you can go through these references. That's all regarding the vertebral region, muscles and movements in the vertebral region.